everyone. Thank you for coming tonight. My name is Megan, and I'm the program coordinator for the Kidney Foundation of Canada, the Atlantic branch. I'm happy to be here with you this evening. I don't know about where you are, but it's freezing here today. But I'm super excited to be here, and we'll get started. So today's webinar is Kidney Disease, Are You at Risk? And I'll just change my slide there. So before we get started, I just want to quickly go over a few items with you so you know how to participate in today's webinar. By default, all participants are muted as you enter the webinar. We keep everybody muted just to help to lower any background noises. And this just helps to keep our webinar flowing more smoothly. Today's webinar is being recorded. You'll receive a follow-up email within about 48 hours after this ends, and that email will include a link for on-demand viewing, and we'll also include a copy of all of the slides that we use today. So there are a few links in the slides, so you will get a copy of those at the end in that follow-up email. And we'll also link an anonymous survey just asking about how today's webinar went. It's just a quick, short survey to get some feedback. And this feedback is important to us just so that we can continue to improve our webinars so we can offer them. So I really encourage you to fill that out once you receive it. And since you're all muted, you will have the opportunity to ask any questions today through just typing in your answer or your question. So just type them into the question and answer box. I believe that's at the top of your screen. Sorry, no, it's at the bottom of the meeting window. So, and this just helps us to, again, keep that background noise kind of out of the webinar. So you can just put your questions in there. Feel free to ask them at any point. I will look at the questions at the end and answer them then, but feel free to pop them in the question box at any point. And just one more thing that we'll go through before we get to the nitty-gritty of the webinar is a disclaimer. So the material contained in this webinar does not constitute medical advice, and it is intended for informational purposes only. No one associated with the Kidney Foundation of Canada will answer medical questions. So of course, please consult a healthcare professional for specific treatment recommendations. Now that we have all of that over with, we'll get started here. Since there are almost no warning signs when your kidneys begin to fail. And this is why it's so important to know the risk factors. The purpose today of this webinar isn't to scare or panic anybody. The purpose is really just to armor you with the knowledge you need to know to help you to make smart choices about your health. Knowledge really is power, so the more you know about kidney disease, the more you will feel confident and in control with making decisions about your health. So today we're going to talk about what kidney disease actually is, some detection and warning signs, symptoms, risk factors, and then we're going to talk about what you can do to keep your kidneys healthy. All right, and again, just ask your questions at any point, just type them in the box and we'll get to those. So your kidneys are a critical part of your health. And if you're listening to this webinar today, I'm sure you already know that. They clean your blood by removing waste from the body through your urine. They help your body to make red blood cells and regulate blood pressure. Every minute, about 1 liter of blood, which that would be about 1/5 of all of the blood pumped by the heart. So every minute, about 1 liter enters the kidneys through the renal arteries. After the blood is cleaned out, it flows back through the renal veins. back into the body through the renal veins. Now, normally people have two kidneys, one on each side. You can see that on the diagram here on the slide. So usually two kidneys, one on each side of your back below your lower ribs. Kidneys are reddish brown in color and they're shaped like kidney beans. That's the name. And each kidney is about the size of your fist when it's clenched. So a normal kidney can greatly increase its workload. So if you were born with only one kidney, or maybe you donated one kidney or injured one of your kidneys, the remaining kidney can work harder to help keep your body healthy. And so that's for the normal working kidneys. So now that we have the basis of our knowledge done of kidneys, why are kidneys so important? So kidneys are just as important to your health as your heart and lungs. Our kidneys have many different jobs in our body. Some are included here on this slide. So our kidneys, of course, regulate our water. Our bodies need just the right amount of water to work properly. So our kidneys remove our excess water from the body, and then they also help to retain water when the body needs more. Our kidneys help to balance the body's minerals. So just like water, many of the substances in our blood and other body fluids need to be kept at the correct level for our bodies to function properly. And when the body is working properly, extra minerals such as things like sodium and potassium exit the body. They leave our body through our urine or our pee. And our kidneys also help to adjust other levels of minerals such as calcium and phosphate. And these ones are important for bone strength, growth, and other functions. Another one of the main jobs that our kidneys do is to help us remove waste products. And these would be things such as urea and creatinine from our bodies. When kidney function does decline, the levels of our urea and creatinine in the blood increase, and those are things that we don't want. So we can test those with simple blood tests. And we'll talk a little bit about that in a little bit. And of course, our bodies produce hormones. So normal kidneys make important chemicals in our bodies called hormones. And these hormones move around in our bloodstream, and they kind of work as little messengers to our body, and they help to regulate our blood pressure, our red cell production, and the calcium balance in your body. So our kidneys do a lot for us. All right, so we talked about what our kidneys do. So now, what is kidney disease? What exactly is it? So the definition of kidney disease actually describes a variety of conditions and disorders that affect the kidneys. Most kidney disease attacks the filtering units of the kidneys and therefore damage their ability to eliminate wastes and excess fluids from our body. Kidney disease, it can range from just mild to severe, and in some cases can lead to kidney failure. Now you'll also hear this term referred to as end-stage kidney disease, which is on the slide there. So chronic kidney disease, or CKD, this is when there's a presence of kidney damage or there's a decreased level of kidney function for a period of 3 months or more. End-stage kidney disease means the end of your kidney function. Your kidneys no longer adequately filter your blood, so it doesn't adequately do those jobs that we talked about on the previous slide. If your kidneys do fail, there are a number of treatment options that you can take. These would be things like different forms of dialysis, transplantation. There's also non-dialysis supportive care as well. Fortunately, most people actually do not progress to end-stage kidney disease, especially if they are diagnosed early and are able to take steps to preserve their remaining kidney function. So that's a big one especially for today, why we're going through this webinar, is all about knowing those risk factors and those symptoms so that you can hopefully get an early diagnosis and be able to start treating it right away. Kidney injury is another one. It's when kidney failure happens very quickly or rapidly. So this could be a result of an infection. Also, it could be any kind of injury, impact injury. So for acute kidney injury, dialysis treatment may be needed urgently, but just for a short period of time. So eventually with kidney injury, the kidney function does often come back. So we know what our kidneys do and what kidney disease is. Now let's talk about the detection and warning signs. So some people, we've said this before, even with serious and progressed kidney disease, some people still don't have any symptoms. But there are a number of tests that your doctor can do to check for kidney problems, even if you don't feel the symptoms. Two of these tests are a blood test and a urine test, and these are used to detect kidney damage and to assess how well your kidneys are functioning at removing toxins and waste products from your blood. I'll quickly review what each of these tests are, but there is more information on our website that you can go to find out a more in-depth explanation of them. With the blood test, it can be used to measure our glomerular filtration rate. So this is a marker that shows the amount of kidney function that you have remaining. It measures how well the kidneys are working by figuring out the rate at which the tiny blood vessels in the kidney are filtering waste products from your blood. And so we also call this the GFR. And the GFR is actually one of the most common ways to measure our kidney functions, or how well our kidney is functioning. We have the serum creatinine level. So this is another blood test that you can do. It's a marker to help indicate how well the kidneys are filtering the blood. So creatinine is a waste product made from muscle use, so using our muscles, and the breakdown of the protein in our foods that we eat. And as the blood creatinine rises, kidney function decreases, sorry. So that's another blood test that you can do. And then we have our urine analysis, and this is another test that can be done to check for kidney problems. So a urine analysis or a urine dipstick is used to look for two things in your urine, blood and a protein called albumin. So the filters in our kidneys do not normally allow protein, so the albumin, in the urine. So if a protein is detected, it can be a sign that the kidneys aren't filtering as well. So these tests, along with other blood tests, x-rays, kidney ultrasounds, kidney biopsies, they can all be done to help your healthcare team to diagnose the specific type of kidney disease you may have, to manage your kidney function, and to determine the type of treatment that is best for you. Risk factors. So there are a number of risk factors for kidney disease. Some that you can control, things like smoking, and then of course a lot of them that are out of your control. People with diabetes, high blood pressure, or have a family history of kidney disease are at increased risk, as well as children born with kidneys that did not develop properly. You do want to be mindful of taking some medications. It is definitely recommended to have a chat with your doctor or pharmacist about all of the over-counter medications that you take before you take them. So certain medications, toxins, pesticides, and illegal drugs such as heroin or cocaine can cause some kidney damage. And an astonishing stat is that as many as 2 million Canadians have chronic kidney disease or are at risk of developing it, and most are unaware of it. So if you are over the age of 50 or fall into any of the categories, the risk categories, it's definitely a good idea to chat with your doctor and ask about the possibility of having a blood test to check your kidney function. So something we have talked a lot about, and I just mentioned, was that kidney disease often starts slowly and develops without any symptoms. If your kidney function does decline and continues to decline, you might start developing symptoms, and that's why it's so important to know what to look for. So each person, of course, is different, but most people will start to develop uremia as the kidneys fail and are unable to remove the waste products from the body. And uremia is when there are high levels of urea in the blood, which has all of the symptoms of its own. So some of the symptoms of uremia that occur as kidney function declines are on this slide. So there's lots of them, things like weight loss, weakness, vomiting, loss of appetite, shortness of breath, leg cramps, itching, chest pain, easy bruising, swelling in your ankles or your legs, fatigue, nausea, having a bad taste in your mouth, restless legs, forgetfulness, difficulty sleeping, cold intolerance, skin color changes, and decreased sexual desire. So you'll notice there are a lot of symptoms here, many of which are present in other disease and conditions as well. So this can make it seem a little overwhelming and intimidating, but we do have a tool for that. So our next slide. Now, this is a tool that assesses some of those risk factors and symptoms we just mentioned. This tool can help to take some of that confusion out of things and to help you give an indication on whether you should talk to your doctor about having your kidney function checked. So this, the link there is on the slide. It's just www.areyouatrisk.ca. And so it consists of 10 multiple choice questions, and it only takes about 10 minutes to answer or to complete. And after you have completed it, it provides you with all of your results and information about all of the answers that you answered for each question. So I encourage you to take this quiz. It's very short and easy. Share it with your family, share it with your friends. It only takes 10 minutes. And like I said, there are so many symptoms and risk factors. So this is a tool that really helps to kind of narrow those down and give you an indication on whether this could be a conversation you can have with your doctor. All right, so we talked about your kidneys, what they do, what kidney disease is, our risk factors, and our symptoms. So let's finally talk about what you can do to help keep your kidneys healthy. There are many things that you can do. In most cases, supporting your kidney health and protecting your remaining kidney function depends on managing other medical conditions that you may have. So things like blood pressure and diabetes. You can help to maintain a healthy lifestyle, and of course, learning more about kidney disease. So we will dive a little bit deeper into these, particularly the blood pressure and the diabetes. All right. So blood pressure control is one of the most effective ways of slowing the progression of kidney disease. High blood pressure, you'll also hear it referred to as hypertension. This can contribute to the development of kidney disease, but the reverse is also true. So kidney disease frequently does cause high blood pressure as well. Another little stat for you, 1 out of every 5 Canadian adults has high blood pressure. So if you have a high blood pressure, what can you do? First of all, it's extremely important for people with high blood pressure to know their blood pressure goals. So what target level they should be in, and to try to make sure that your blood pressure falls within those ranges. Generally, you should try to keep your blood pressure below 130/80. But again, everybody is different and everybody's situation is different. So you should always talk to your doctor or your nurse about what your target blood pressure should be and how often to check it. If you do have high blood pressure or want to prevent having it, you will most likely need to make some lifestyle changes, and some of them are on this slide here. So incorporating healthy foods into your everyday life, particularly those low in fat and salt. Quitting smoking if this is something that you do. Maintaining a body weight that is healthy for you. Again, everybody is different. Those numbers should always be individualized to you. So one of the things that you can do is talk to a registered dietitian about your diet and your lifestyle. You need to exercise regularly, so getting that movement in there, minimizing or limiting the amount of alcohol that you drink, and de-stressing through relaxation techniques. There's lots of different ways that people de-stress. I think it's definitely another really individualized thing. Some people like yoga, meditation, hot baths. So you always want to keep that stress down. And sometimes, in addition to lifestyle changes, people need to take medication in order to help control their blood pressure. There are many different types of blood pressure medications. And again, everybody's needs are so incredibly different. So it is important to talk to your doctor about this, and you and your doctor will decide which medication is best for you. So diabetes and kidney disease. It's very important to control your blood sugars if you do have diabetes. There are some tips for managing kidney disease if you do have diabetes. Just like with high blood pressure, you want to talk to your doctor or nurse about what your target blood sugar levels should be and how you should check it, or how often, you should check it. You should test your blood sugar as often as directed by your healthcare provider. This is very important. Maintaining a healthy lifestyle, of course. So this would be things like diet and exercise. Like I said in the last slide, a registered dietitian can help you to make the food choices that are good for both your diabetes and your kidney health. Again, quitting smoking if this is something that you do. Infections is an important one. So infections in people with diabetes tend to progress rapidly. If left untreated, many infections, especially urinary tract infections, can further damage the kidneys. So people with diabetes need to take special care to have infections treated immediately. And of course, your feet should always be checked regularly as well. And kidney function should be tested annually or as often as your doctor suggests. And this can be done with urine and blood tests that we talked about earlier. As with all conditions, you want to take all of your medications as recommended by your healthcare team. And another great tip is, if you do have diabetes and kidney disease, or even just diabetes, is to ask your pharmacist for a sick day list of medications. So this would be a list of medications that should be stopped if you are sick and unable to keep foods or fluids down for a period of time. So it's always better to be prepared. So of course, I said this earlier, but knowledge is power. Learning more about kidney disease and armoring yourself with the tools and information to identify risk factors and symptoms is one of the first steps to preventing the onset of or prolonging the progression of kidney disease. Again, knowledge is truly power. The more you know about kidney disease, the more you will feel in control and confident in making decisions about your health. Today, we did go through a lot of information. Luckily, all of this information can be found on our website, and most is also available available in hard copy if that's something that you would like. And we also have lots of other resources on our website and through the Kidney Foundation that I'm going to go through quickly before we get to our question period. So webinars, of course, you're attending this webinar today. We have done a few webinars in the past. So our national team does webinars. We have lots of those on our website. Atlantic Canada, this is something that we have started. So we frequently do webinars now on all different health topics related to kidney disease. As you can see here on the slide, we've done previous webinars on things like the COVID-19 vaccine. That was just the other day. And we've done Atlantic branch information sessions. We've done some nutrition sessions as well. So definitely check those out. I said this earlier, but this webinar will be recorded. So you can find this webinar. It'll take a few days to get up on the website, but you can find it there and you feel free to share it with anybody. And our Kidney Community Kitchen. So if you visit kidneycommunitykitchen.ca, this is our little branch of nutrition information. So on this website, you can find lots of recipes. We have blog posts from dietitians. There's also a feature on there called Ask a Dietitian. So you can ask any kind of diet questions that you may have, nutrition questions about your situation, and they can answer those. And we have lots of kidney health resources on our website. There's some, if you go under the kidney health tab there or the support tab, we have lots of different brochures. We have some little manuals about living with reduced kidney function. We also have one for kidney failure as well. And most of these resources, we do have hard copies as well. So if you're somebody who likes to have something in your hands and read it that way, just reach out to us. My email will be at the end of this webinar, and feel free to request any of those hard copies and we can send those to you. Our virtual peer support groups. This is something I'm super excited about. We do have a peer support program. So this is for individuals who have kidney disease or reduced kidney function, donors as well, kidney recipients, and also family members of individuals who have kidney disease, or if you're a care partner, you're caring for someone with kidney disease, you can also join these. We have one-on-one peer support. And again, just feel free to contact me with the information at the end of this, the last slide. But we also have things called peer support groups. And so this is when there's somebody facilitating the group and kind of asking questions and creating a conversation. We've had really good feedback from these. If you're not comfortable talking in them, you don't have to. We have some guidelines for it. So if you're by chance called upon, you can just say pass. And so you can listen or you can participate if you'd like. So these are our next 4 dates for them. And if you're interested in any of those, just send me an email. And the last little thing that I'm going to go through here is our patient forum. This is something super exciting that is happening in March. and it's a virtual patient forum. It's going to take place over 3 days. It's going to start March 9th and go to March 11th, which is World Kidney Day. And the theme for this is living your best life with kidney disease. This patient forum was developed in partnership with people living with kidney disease and will bring together patients, care partners, healthcare professionals, and researchers who will share information to help educate, empower, and inspire everyone who is attending. There's lots of different sessions going on. Some topics include things like self-advocacy, complementary and alternative therapies, managing fatigue, movement wellness, fertility and family planning, finding humor in difficult topics, things like cannabis, and kidney health. And there's also going to be things like breakout sessions that we're going to have during it. And those topics are things like body image and sexuality, when to start dialysis, peer support, and patient empowerment. So this is something super exciting coming up. The agenda and all of the other information that you would need to know about this is on our website. The link is on this slide, or you can just go to our website and go under events, and it's there as well. If you have any questions about it, feel free to visit the website, but you can also send me an email as well. All right, so we're at our question part now. I'll just quickly go through the questions, see if there are any. This is my contact information, so if you are looking to get in contact with me about this, feel free to send me a message, give me a call. If you do have any questions if questions come up afterwards, feel free, you can always send them to me as well, and I can get back to you that way. So let's just go through the questions here. Oops. I think I stopped sharing my screen. Okay, there we go. All right, let's see here. All right, so we have a couple of questions. That's awesome. Somebody's asking, what should my blood pressure be? So generally, you want to keep your blood pressure below 130/80. But again, everybody is very different, different situations, different conditions. So you always want to double check with your doctor or your nurse. You can have conversations with them just about your different blood pressure targets. All right, here. Oops. So another question here is, why do people have to be mindful of some over-the-counter medications? So this is a great question. Both prescription and over-the-counter medications are actually filtered by your kidneys. So this means that your kidneys help to break them down and excrete them or get rid of them from your body. And so if your kidneys aren't working properly, or if you have some decreased kidney function, some medications could potentially cause you harm. So this is always something that you should chat with to your doctor about. Your pharmacist is also a great tool, a great resource that you can use as well. So again, with everything, definitely check with your doctor first, or in this case, your pharmacist. Another question here is, what should I do if I fall into some of the risk categories? Another great question. We talked about some of those risk categories, the big ones really being diabetes and blood pressure. We also talked about some symptoms. So what do you do if you fall within the risk categories or are experiencing some of the symptoms? If you have any worries at all about developing kidney disease, definitely bring it up to your doctor and ask if you can get your kidney function checked. But another resource that you could use in the meantime is that Are You at Risk tool. So we talked about that a little bit earlier. The link is in the slides, and you will get a copy of these slides at the end, but it's just www.areyouatrisk.ca. So that will give you all the information that you need to make a decision on whether you should talk to your doctor about it. But of course, when in doubt, it's a quick question to your doctor. We have all right, so we have not a question, but a comment. And it says, it is scary that a lot of people don't have symptoms. So I think what that's saying is that a lot of people have kidney disease with no symptoms. And so at the beginning, so they don't know that they have it. And that is scary, but I think what's really important, we mentioned earlier, is that knowledge is truly power. You know, knowing all of the information about kidney disease, knowing those risk factors and those symptoms are so important so that you can make some decisions on whether you should talk to your doctor or not. So again, like I said, when in doubt, it's a simple question that you can ask. And then the last question here is, it's a question about peer support. So are the peer support groups virtual? They are virtual at the moment, of course, because of COVID-19. So the way that they work is when you register, I will send you a link to the meeting about 24 hours before it begins. And what happens is you don't have to download anything. All you have to do is just click on that link when it's time to join the meeting, and it'll pop up for you. There is also an option of entering the meeting through audio. So if you just want to enter through telephone, you can do that as well. And again, if you ever have any questions about that stuff, you can contact me. And I think that is all of the questions. So we did end a little bit early, but I want to say thank you to everybody who joined the webinar tonight. It's very exciting. Of course, at any point, if you have questions, let me know. And again, this webinar is being recorded. You'll have access to the recording. I'll send you an email in the next few days with a link to the recording. You'll also get the copy of the PowerPoint slides as well. And you will get just a short survey asking how this went. And that just helps us to improve webinars in the future. If you ever have suggestions for webinar topics, again, contact me at any point. We really want to offer you guys things that that you're looking for. So any ideas, send me a quick message, or you can also put it in the survey. So thank you everyone who joined today. I hope everybody is having a wonderful evening, staying warm inside.